Hello, my name is Emma Marish, and I'm going to be a sophomore at New London High School in Wisconsin.
My name is Ramona, and I'm going to be a junior.
My name is Khalil, and I'm also going to be a junior.
My name is Zoe, and I will also be a junior.
My name is Jenna, and I will also be a junior.
My name is AJ Ogilvy. I live in Maryland. I'm also going to be a junior.
ARI, formerly known as acute respiratory infection, can interfere with proper breathing and impact either your upper or lower respiratory system. Our manual establishes preventative measures against ARIs and educates on ways to decrease the rate of its transmission.
Project goals. Our first goal is to educate the Bauchi community on understanding methods to prevent the harmful impacts of ARI through information pamphlets which aim to promote the use of vaccinations and highlight health clinics for the community.
To create affordable antibacterial soaps to protect against ARIs using ingredients which are native to Bauchi. And finally, to create a fun and engaging way for the children of Bauchi to learn about the necessary hygiene practices needed to protect themselves and their community. How can the Bauchi community prevent ARIs? The Bauchi community can prevent ARIs by social distancing with those with an ARI, through coughing or sneezing into elbows instead of hands, decreasing the likelihood of ARI transmission through touching contaminated surfaces, and finally through basic hygiene practices. For example, hand washing and using antibacterial soap, which we teach the Bauchi community to make in our workshop. Personal prevention strategies. Through the use of personal prevention strategies, the inhabitants of Bauchi State are able to be equipped with the skills required to support themselves and protect themselves from ARIs. Personal prevention strategies consist of measures aiming to inhibit the occurrence of a disease and simultaneously protect the community. These include frequently washing hands and air drying them. This is effective because it doesn't require extra resources such as towels, and it reduces the likelihood of transmission of germs between a frequently used towel and freshly washed hands. Secondly, through ventilating buildings and homes, which is easy and effective through opening windows and doors, reducing the concentration of airborne pathogens and the likelihood of touching a contaminated surface.
Environmental intervention is to not just be aware of your surroundings when it comes to insects, but to also keep yourself practiced and up to standard when it comes to hygiene. Taking care of yourself, not just to keep you safe from bacteria and infections, but to keep those around you safe as well. Those who don't have many cleaning or self-cleaning products, it might be a little harder, but homemade antibacterial soap can get the job done in a great many ways. By providing education and information, citizens will become aware of the risk of acute respiratory disease. Furthermore, informing the community of the simple daily safety measures that they can partake and can potentially make a large impact on their society. Media campaigns, public service announcement, and posters hold great value in assuring the community is knowledgeable about the disease. Community engagement and social mobilization promote illness protection, symptom awareness, and disease prevention through workshop and events, reducing the spread of the infection.
Here are our workshops: an educational song with a game, hand hygiene, and a vaccination pamphlet.
Okay, so our first workshop, it has a target audience of school-age children. So we wrote a song because we thought that would be a fun and engaging way to educate them about how simple ways that they can prevent the spread of ARIs with their friends and themselves and their community and their parents. And hopefully by the end, this song will be stuck in their heads, and they'll be singing it and spreading the information to all their friends. So since none of us are really musically talented, we had someone who is sing this song for us. So here it is. Enjoy. And that's the lyrics. It's not connected to audio. Yes. Thank you. So the pamphlet that was on there is going to be distributed out to the children, and so they can learn it and follow along. And yeah, and the girl who sang it wants to stay anonymous, but she's an intern in the neuroscience program. So with the song, we have a review game just to reestablish what they have learned from the song. So the game is going to be, so like the students are going to stand in a circle. There's going to be a ball and it has numbers around it. And they're going to just play a simple game of catch. And when you catch it, whichever number your thumb lands on corresponds with a question on a paper that the leaders will have. So all the questions, most of the questions, can be answered just by listening to the song again or singing it. So it really helps them to recall and remember what they have learned, which is the goal. So here are some examples of the questions that there will be. Okay.
So introducing our second workshop, we would like to promote hand hygiene within the community as well as at home. And we believe that better health practices will essentially help eliminate disease, specifically ARIs. So we are encouraging the people of Bauchi to use their household items in order to create a homemade soap, which is very affordable as well as accessible and also sustainable. So overall, we just want to educate the community about the importance of hygiene in general, but also how to eliminate bacterial and viral infections. So here are the materials for the soap, all of which can be found in a native's home: a large bowl, pan of water, or a pan and water, strainer, wooden spoon, palm leaves, and coconut oil or palm oil. So instructions, steps 1 through 8 are actually how you create the lye, and lye is essentially what is going to make the soap antibacterial. So I'm going to give a quick overview of the instructions. There's very detailed instructions on the screen, as you guys can see, but a quick overview is what you do is you mix wood ashes and water, and then you let it sit. And then once the solution is crystallized, you will add water and palm oil for moisturization, or you could also use coconut oil, as I mentioned before. And you pour the solution into the pan, and you're going to want to add palm leaves at the bottom as a supplement for parchment paper. And then you let it harden and enjoy. So along with the instructions for the soap making, we also have provided a template to teach the citizens of Bauchi how to successfully wash their hands, but also use their new soap effectively.
So I know vaccines are not as fun as a song, but they're still really important for helping protect certain groups from specific ARIs. These are diseases like influenza and RSV, which can be very popular within a population. Vaccines are effective, safe, and they're cost efficient for many people in Bauchi State, Nigeria. The only problem with vaccines is that there's a lot of misinformation circulating the internet, the just mouth by mouth in Nigeria as a whole, not just Bauchi State. And this has a lot to do with the fact that they are a Western medicine. But to help combat this misinformation and distrust, we are going to encourage citizens to get vaccinated against specific ARIs with the help of asking a trusted religious leader and or community leader to help promote the vaccines and answer the questions during our workshop, where we're just going to show them the pamphlet. We're going to read it with them. We're going to go over it. We're going to answer their questions and just do a little Q&A with it. Here is the pamphlet. As you can see, we go over topics like what are ARIs, what are vaccines, where and when to get your vaccines, misinformation about vaccines, and then local clinics within the area that the citizens can receive their vaccines. Next is our budget and resources. Majority of our budget went to resources and materials for the soap making, which includes bowls, strainers, and pans, but also paper, toy balls, and markers were budgeted. In the budget, we were able to stay under, and we were lucky that we only spent $365 out of the $500 allotted. But with the remaining 140, we are either gonna spend the money to increase our resources and allow more families to make soap and enjoy our workshops, or we were gonna think about giving it to a local foundation, whether that be Leadership Initiatives or another one within Bauchi State. And
in conclusion to our slideshow, an amazing song by Jenna. We believe properly following procedures and seeking effective treatment for ARI, complications are of utmost importance to the community health. This proactive approach not only prevents future ARI cases, but also ensures the safety and recovery of affected communities. By adhering to these measures, we safeguard the well-being of the community and create a robust defense against ARI, fostering a healthier and more resilient society.
Thank you. Thank you. Thank you for lighting the mood up, after a long day. Thank you so much. It was indeed a wonderful presentation. It had a really important message along with it. However, the text was a bit overwhelming. You could have used more of graphics or more of pictures to make it more engaging, because the text was just overwhelming and it was hard to follow. All in all, everything was wonderful. I loved the presentation. You guys did amazingly good, amazingly well. You really worked hard, and your hard work is showing in your work, and I'm really proud of all of you. Thank you so much, and congratulations on your successful completion of this program. Congratulations, guys. That was very interesting to watch and to listen to. I really wanted to listen to the song, so I'm glad that I got to. And I like the fact that you went the extra mile to write out a complete script, record it, have like a music background. I really like when people go the extra mile, and you did that. So kudos to you and a really good job. As well, I like the fact that everyone presented, everyone like gave their information. I like to see like some form of shared teamwork, and I can see that here as well. You also really supported each other. That was nice. I also like the fact that you focused a lot about prevention. You talked about health education being a prevention mechanism, and that's great. People forget that, but that's very important when it comes to prevention as well. Yeah, I think that's pretty much what I have here on my list. And then all of your prevention tactics were focused on the things that you talked about earlier, which is like individual, community, and also like general prevention. So it was very clear that you like thought about a person, a community, and the country. And that's the only way that prevention can work, when we're all working together. So great job. You should feel really proud of yourself, like Aisha said. I hope you sleep well today, finally. And congratulations. Good job.
Ah, that was powerful, guys. I must say it was quite interesting. And the song, actually, is there any song back those days? It just sounds so familiar and quite interesting. Okay, because it was just rhyming in my head and quite interesting. I'm sure that was nice. ARI song, hand hygiene stuff, vaccination. That was quite impressive, truly. I'm highly impressed. There's an area I wanted you to touch, but no problem. You've done more than enough to really, this great, amazing. I hope you have the song somehow in local languages, because I like the way you reach out to somebody in another program who is talented to give you this. This is amazing. Congratulations, guys, and well done.
Sorry, and then lastly, I'm just really curious, how did you also find out about the Al Muhiba Foundation?
Yeah, basically I just looked up charity foundations in Bauchi, and I looked at the message and the goals that the foundation has, for example, improving health and creating more and like promoting health and education in Bauchi. So I thought that the message applied to what we were doing.
That's good. Good job. Good job.
Thank you so much, judges, for your feedback and time. And thank you, fellow internship and staff, for listening.